Hey there, this is Dr. Tall Paul Simon, Psychiatrist, coming at you from my home office with Sleepy Joe here. This video, wanted to talk to you about sleeping trouble, insomnia, how we evaluate it, how we treat it, and what you can do on your own to help with sleep trouble. Before I get into it, please subscribe to this channel so that I can keep making videos and give advice and share helpful information. So insomnia, very common issue, very, very common. So you, just like I have, sometimes struggle with sleep issues. Some people really, really struggle with a lot more. So let's talk about what works, what doesn't work, and what can be done. All right, so insomnia, the most effective treatment, I know you're not gonna like hearing this, but if it's just insomnia and not anxiety, depression, other stuff, is sleep hygiene, okay? I know it's unpleasant to think that there are things that only you can do to improve sleep, but it is borne out by studies and scientific studies. The standard of care for long-term insomnia is not medications, but sleep hygiene. Okay, so what is sleep hygiene? Sleep, okay, we know that term. Hygiene is clean sleep, okay? It is basically having really good sleep habits. Okay, so what does that mean? You may say, well, I have a good amount of sleep. I have good sleep habits. And say, well, maybe you do, maybe you don't. I would suggest, in addition to listening to this video, looking up online the term sleep hygiene and PDF. Find a print out PDF form that a sleep lab or sleep clinic would give to their patients that come to them for sleep issues. So what is sleep hygiene? What does it look like? I'll talk about other causes, of sleep issues and other things, but just straight up insomnia where somebody's having trouble sleeping, the number one thing is bad sleep habits. So going through what makes good sleep habits, bad sleep habits. Regularity is key. So going to bed, waking up at the same time every day. Now, a lot of people say, oh, it's the holiday, it's the weekend, it's all good. Nothing matters on those days. Well, it does. Your brain doesn't care what day of the week it is. So regularity is key. Weekends count just as much as the weekdays. Now, staying up a little bit later, sleeping in a little bit later, okay. Sleeping in if you're sick or coming down with a cold, you got to fight something off. Okay, that's fine, but regularity is key with the sleep. The amount of sleep is also important. So sometimes people will come to me and say, Doc, I can't sleep, help me, I need something for sleep. And they're aiming to sleep 10, 11 hours a day. They're spending that much time trying to sleep. Now, if your body only needs 8 hours of sleep, some people can get by with 7 hours of sleep. If your body only needs a certain amount of sleep and you're trying to sleep more than it needs, you're not going to be able to sleep well. You'll be tossing, turning, dreaming, having nightmares or whatever. It's just not going to be good, especially in that last part of the night. So the amount of sleep is really important. Caffeine is a very simple thing to keep an eye on. Now, people will tell me, well, I don't drink any coffee or sodas after dinner. Say, well, caffeine stays in your system, half of it, 8 to 10 hours later. So when you try to turn off your mind in the middle of the night, at night, and you can't quite turn that switch off, that may be caffeine. Now, other things that can cause insomnia, other than just bad sleep habits and caffeine, are anxiety trouble, depression, bipolar, things like that. I see a lot of that stuff. So when I have somebody coming to me as a psychiatrist saying, I have sleep trouble, I'm always looking for a cause, okay? Now, usually people that come to me with sleep trouble, it's not just insomnia. There's anxiety, that's probably the most common thing, but depression as well. So you got to look at the context as far as what else is going on with a person. Is there caffeine? Do they have bad sleep habits, which is the number one? But is there anxiety, worry, where you're just kind of dwelling or dreading the next day and you don't want to go to work next day, and it's just you're stressing out about things and it's just, you can't turn it off. So there are guided relaxation videos as well, and apps like Calm and Headspace that address those things. Those can be useful tools as well. But sometimes if it's bad enough, anxiety and depression really needs to be treated in order for the person to sleep well. So with sleep, a lot of people ask, well, doctor, just give me a sleeping pill, you know, or something. And really, that is not how sleep trouble is addressed anymore. We used to just give sleeping pills, but according to studies, they increase the risk for dementia and falls and car accidents the next day, even when the person's not tired. So there's some kind of leftover residual cognitive effect there that people run into, and in the long run, sleeping pills like Ambien and Sonata, Lunesta, all those kind of things don't work any better than good sleep habits and addressing the underlying causes for sleep trouble. That's the key. Addressing the underlying causes for sleep trouble and having good sleep hygiene. Okay, so sleeping pills can be sometimes useful on a very temporary basis. If jet lag or time zone change or some crisis happens, acutely, and all of a sudden you got to settle down. But after a month, none of those sleeping pills will really work very well, and you'll be stuck on them. So do work on the sleep hygiene, okay, and look for other causes of sleep trouble, okay. All right, I hope you find this useful. If not, let me know. I'll try to answer any questions you might have. You guys take care, and we'll talk again soon. Bye-bye.